My name is Cale. I am originally from Australia, but I am now also Irish. My background is that I'm a doctor, so I trained in Australia, and now I live in Ireland and I work in public health in Ireland. But I would like to, I work kind of in global health with the NGO I work with, and would like to move more into the global health to the future, I think. In terms of other things, I guess, I'm very interested in history and politics and travel and those sorts of things. So I try and travel a lot, and I guess it's kind of helped inspire me to be interested in global health. I know that I was studying medicine thinking I might do GP or something like that initially when I was in medical school, but then I went on a university prac to Nepal, and then seeing the vast differences in health outcomes, which comes from not having such a strong public health system. I guess I didn't know it at the time, but I thought something along those lines would be what I would be most interested in. And the more I looked into public health, the more I studied public health, the more interested I became. And now I am in public health, so it's gone well. Yeah, so I heard because my NGO that I work with, CGHI, is partnering on some projects with Global Health Next Generation Network. I heard about CGHI through a colleague who I work with who invited me onto a webinar, and the other person on the webinar was the president of CGHI, that was Giovanna. And then from there, recently, we got the opportunity to partner with Global Health Next Generation Network on a few projects. So, and I thought it was a great opportunity for, looking at from CGHI's point of view, from CGHI to partner with such a network. And then I saw the offer. Yeah, it seems like you do a lot of great work as well. So, yeah, excellent. So I work in one of the departments of public health in Ireland. My technical title is Senior Medical Officer, but I am just one of a group of people who try to look after the public health of my certain area of Dublin in Ireland. It's mainly at the moment all COVID related, and that's most of the reason why all of us are there and how we got into it and how I managed to get into it as well recently. Because before this, I was doing research at one of the universities nearby, public health policy research, really. So that, but we also respond to other infectious diseases and then any kind of threats to the public. So we've been doing some work with air pollution recently and water quality, been doing a bit of kind of advocating work as well. It was a bit all over the place, really. I guess I just kind of came at the right time that I was showing interest in public health in this particular role, just as the pandemic was starting. But how my career path to here? Well, I guess I was studying medicine in Australia, and I did practice overseas. So I went to Nepal and I went to Mongolia. So that kind of got my interest in global health and public health. And then I was working as a doctor, but I studied my master's in public health. From there, I was then doing a lot of traveling and working for a few years in Australia, but traveling around a lot because I like traveling. And also I think that links in with global health somehow. And then in 2019, I moved to Ireland, and I got a job in research, in public health research. I was doing that for a while, but then the pandemic started, and I thought that they would be needing, that all people would be pulled into medical and health roles that are available, and that's what ended up happening. So I managed to attach myself to the local public health department here, and I've managed to stay in there. I don't know. A lot of it for me was kind of luck and timing. I think, like I was quite persistent as well. Like I was kind of looking at this role, a year before I got here and sort of scoping it out and emailing. And then when I got to Ireland, I met the person who would be my manager, even though my medical registration hadn't yet moved over to Ireland. So there was a lot of kind of persistence and ongoing interaction. But I guess something that has proven very useful for me when I'm doing applications is that I've had lots of different experience in lots of different areas. So that wouldn't work necessarily for all roles, and definitely not in medical roles, but in like public health and global health roles. I found it really useful that I can say that I've been involved in research, like policy research in Ireland, and some of my other NGO work is in Georgia, with the country of Georgia, with hepatitis and HIV. So I've had publications related to that as well. So being able to say that, I've done, for example, like the statistical analysis with the publications, and I've worked with, refugee populations and minority populations. And also I have, the master's and the clinical background in medicine, just kind of that variety of experiences. I keep finding that, the applications might want all these different categories, and just having those variety of experiences and being involved in lots of different things helps cover a lot of ground. So yeah, I found that very, very useful. That's, I guess, my secret. A lot of the jobs I would kind of look to working in the future, they need a lot of technical knowledge, which, you don't really realize what you don't know until you know that you don't know it, something like that. So you look at these, I would have looked at these applications like 3 years ago and been like, oh yeah, I know that. And then now I actually work in that, and I'm like, oof, I'm glad I'm working here now and getting this experience, because my God. But, so at the moment, I guess what's useful is, in my current position, is kind of having the experience with, I guess, infectious diseases, because so much of global health work is around infectious diseases. And also that kind of exposure and knowledge of other public health problems, like air pollution is one of my big interest areas. So not only knowing and using the knowledge of air pollution, but also kind of knowing what practical things stand in the way. So like, when we talk to people about air pollution and try to improve air pollution in Ireland or whatever, it's very interesting to see what are the actual causes and what kind of things, what legislation and what stakeholders and that kind of stand in the way of making changes, trying to work out how to, diplomatically and politically change people's minds or maneuver around people or overcome obstacles, just all of those sorts of things. So, if I, in the future, go on to work in, for example, like global health air pollution, I'll have that experience of overcoming stakeholders who don't want to change air pollution or something like that. So all those kind of technical and knowledge and the soft skills as well, I think, are all really useful. It has to do with kind of the, striving for the ability for everyone to be able to have kind of equal access to health and equal opportunities for a basic standard of health, and to be kind of protected from things that will unfairly impact people's lives. So I think that the act of global health is trying to make it so that everyone can kind of live to their full potential, whether that be, protecting them from infectious diseases, or trying to reduce discrimination, making sure that all people in the population have access to healthcare, or trying to make it so that people don't have to go to work where they're exposed to horrible things that detriment their health. I think that's what global health is, trying to stop and trying to nurture, equality in health for everyone, so they can reach their potential. just get in there. I don't know. Well, I don't know, there's so much in health and in public health and in global health. There's such a variety of options. So whatever anyone's interests are, they can find it, I think. But as in regards to tips, I don't know. It's important to be interested, to keep a wide kind of vista of all the things going on, to try and avoid, I guess, being too rigid in your view and your ideas and your opinions. Being open to things like, I don't say criticism, but being open to kind of other ideas, other ways of doing things. Because I think what's really good about global health is you kind of have an opportunity to share with people all around the world, different ways of doing things to improve people's lives. So thinking that, if you are trained in a certain country, you have the answer to another place's problems, it doesn't really work. So I think going in, having that kind of openness of mind to the way that people do, the ways that people can do things, the ways that people can affect change in other places that, think differently, have different cultures, I think is really important. And with that, also trying to build that experience in all those different range of kind of backgrounds, because I daily think back when I'm working in this job, I daily think back to, my experiences in Georgia and Mongolia and Nepal and Greece and all these sorts of places. And it definitely does impact on how I work here. So I think, just having that openness of mind, having that openness to experience, and trying to synthesize all of those sorts of things, I think is really important for people going into the field. Well, normally, I log in at 9 o'clock and check my emails. Sometimes there's many, sometimes there's not many. And then we have a team meeting at 9:30 where we discuss anything that's significant at the moment. And lately it's just all been COVID. There's not really much else going on besides COVID. And then just get on with the day. So some days, in my team, we have different people who lead on different things during the day. So say, for example, yesterday I was leading on taking general infectious disease queries. So that's things that aren't COVID. So yesterday I was getting in cases of, just other infectious diseases that we care about in public health, and I was following them up and making sure any appropriate public health actions had taken place, such as vaccination or screening, vulnerable contacts and things like that. Today and yesterday as well, I've also been reviewing some, I've been trying to put together a meeting with the local municipality or council here to see how they ran a pilot of trying to encourage people to take active transport like cycling or pedestrian transport to work. So trying to organize a time where we can all talk about that, and we can find out in public health how they did that, and try and work with that. I was also, again with the same council, looking to make a kind of a template for how we would approach when we're consulting about development plans. So from a public health point of view, having a list of things we will go through when we're looking at plans, like have they considered, the impact of air quality? Have they considered, migrant populations in this development plan? Have they considered how they'll deal with water quality and, physical activity and those sorts of things? And then also, putting together a small evidence piece recently on green space in urban environments as well. It's been interesting. Just before I was on this call, I was talking to someone in a local school, about an issue they had around some COVID cases, because it was quite busy. My team was quite busy today, so we had a lot going on in a lot of different areas. So yeah, those are the main things. So deal with all of that until whenever it finishes, hopefully 5, sometimes 6 or later.